the additional data from the day before, and 4,186 of those results are people who have registered that they have a positive rapid antigen test. That puts us at 109,524 active cases, and sadly I can report that we have one new reported death, a male in his 70s who I understand had significant other medical complications, but we do pass on our condolences to the family and friends of the individual. Two new local government areas reporting positive cases, Arakoon and McKinley. We did 50,038 tests. Again, some of those tests will be a lag from the day before. So we've seen about 70 tests over the last 48 hours and about 30 odd positive cases over the last 48 hours. So we're sort of keeping within that same level, but we do expect that that is an underreporting, and there's other people, many other people in the community who are showing symptoms who have not either registered test or come forward for a PCR test at this stage. We have 502 people in ward beds at the moment with COVID and 27 in ICU, 6 of those ventilated. Our vaccination rates are now at 91.16% and 87.85% double dose, and we now have had 709,133 people get their boosters. But that still means we have over 50% of the eligible population for boosters who have not got their boosters yet. So please come forward either at a state vaccination centre or a pharmacy or a GP to get your booster, because we know that makes all the difference when it comes to the severity of your illness, and it is about keeping people out of the hospitals and out of ICU. I want to thank all of our parents and the little ones who came forward yesterday to get vaccinated. Many more coming out over coming days and weeks. We did 6,539 5 to 11-year-olds in our state vaccination clinics yesterday, which is amazing, and we now have 38,404 people in our booking system, and that is out of 478,000 eligible 4 to 11-year-olds across Queensland. So that's just fantastic. Of course, we know that parents are also wanting to go to pharmacies and GPs, and we do hope that the vaccine is supplied from the Commonwealth as quickly as possible so that we can get all of these sites up and running and offering vaccinations, and not just the state vaccination clinics. And I understand pharmacies and GPs are not taking bookings at the moment because they want to see those vaccines in their hands, so they're not having to cancel bookings, and that's completely understandable, but we need the Commonwealth to get these vaccines as quickly as possible. Can I also give a shout out to the wonderful Queensland Health team, all the materials, Birdie and the virus book, and all of the kits that have been given out to kids. This helps kids understand the virus. If they test positive, or mum and dad or their brother and sister or a friend, just helps them understand this a little bit more. And I want to thank the Queensland Children's Hospital and everyone who's been involved in the development of this book. It is just fantastic. What I will say to parents who are walking into our vaccination centres, we are taking walk-ins, but it will be much easier and quicker if you register first, especially when you've got 2 or 3 kids you're taking in at once to get vaccinated. If you are already registered, it will mean that you will move through the process quicker, and we really do ask that you do that. It'll make it easier for you, for your children, and of course our staff as well. So I'll leave it at that. Ask the Chief Health Officer just give an update, particularly about our hospital situation and ICU. I do want to say we're here standing outside the Queensland Children's Hospital and just talking to the staff here. There are 12 children who have COVID who are admitted here right now, and 1 in ICU. Many of those children are too young to have got vaccinated before yesterday, and that's a reminder for all of us to make sure we are getting vaccinated and we are getting our boosters, because it's not just about protecting yourself, but it's also reducing the risk of you spreading it to young children. Thank you.
Thank you very much, Minister. So I was going to focus on hospital care. At present, there are 27 patients in intensive care units across Queensland. 6 of them are on ventilators, so that's an increase of just 2. Now, just to put that in context, I was in Tokyo at the beginning of the pandemic dealing with the Diamond Princess outbreak, where we had 700 people infected with COVID-19, of which over 30 were on ventilators in intensive care units. So 700 positives, over 30 on ventilators. Now in Queensland, we have well over 100,000 people that are infected. We've documented over 100,000 infections through testing, and we have just 27 people in intensive care units at the intensive care units of Queensland at the moment. The lesson is the vaccines are working. They're specifically working in preventing people from getting critically ill and reducing hospital admissions. You can still get sick with this virus if we're vaccinated, and all of us by now will know people who have been vaccinated who do get an illness, but they're stopping us ending up getting into that intensive care unit. And it is the disease we are seeing now is quite dramatically different from what we saw at the beginning of the pandemic. But as predicted, the number of patients that are getting admitted to the wards of the hospitals is beginning to escalate. So we had 502 people in Queensland hospitals, hospital wards as of 7 p.m. last night. 502 as of 7 p.m. last night. That's up from 419 the day before. 419 the day before. So that is escalating fairly rapidly, and that is exactly what it is expected to do, and that will continue based on our projections until the beginning of February. So those numbers will become quite significant in the coming weeks until the beginning of February, and then hopefully, if the mathematical modelling is correct, it will start to decline after that. That is what we're expecting. Now, where are these cases? These cases are right across Queensland. They're everywhere, every part of Queensland. We had the additional LGAs of Aurukun and McKinley last night, but you can acquire this virus wherever you are in Queensland. Gold Coast remains a hotspot. There's no question about that. They had an additional 23 admissions to their wards yesterday. And to give you some context of that, a typical hospital ward is somewhere between 24 and 30 patients. So that's effectively almost an entire ward in one day. And that's expected to continue for a little while, but they have planned this well in advance. I know this because I was a part of it, and they are dealing with that, moving patients where appropriate, using the private sector as appropriate. So there are plans in place for dealing with these increasing numbers. In addition to the Gold Coast, we're beginning to see increasing numbers of patients presenting to the hospitals in the south part of Brisbane, the parts of Brisbane south of the river, and also the Sunshine Coast. The numbers seem to be increasing in those parts of Queensland. And eventually it will spread right across Queensland in larger numbers. But we're seeing the virus right across Queensland, but those, at the moment, our major hotspot is the Gold Coast, and it looks like southern part of Brisbane will be next, and as well as the Sunshine Coast. In terms of, as we mentioned before, and we sadly have to report the death of one man in his late 70s. From COVID-19. He had very significant underlying medical problems. We are looking after 32,852 patients through our COVID home system. There were 50,038 tests conducted yesterday. That includes the catch-up of numbers from the preceding day. Our vaccination coverage, 91.16% one dose, 87.85% 2 doses. And I can't remember, the Minister mentioned that we can report that 6,539 children aged 5 to 11 received their first dose of vaccine yesterday. I'll hand back to the Minister. Thank you.
Questions? Do you know if the man in his 70s who died, did he die at home or in hospital?
I believe he may have been in a nursing home. So I think that's correct. He's in a nursing home.
If he did die at home, would it be the third death?
Yeah, I don't believe he died at home. Yeah, they haven't been able to dissect. They've just given us, here's all the current data as at 7 p.m. last night. So they have identified the problem. It's been rectified. It was a software problem to do with an upgrade, but they've just been able to give us, the one lot of data. As I say, we expect that data is not completely reflective of what's happening out in the community, that some people are still staying home when they're symptomatic and not coming forward for PCR, or haven't been able to get access to a rapid antigen. Well, look, they've rectified the issue, and the team looked into it over the last 24 hours and have been able to, fix the problem. Sometimes these things will happen, but the fact that they were able to fix it within 24 hours is, shows how quickly our team can respond. Yeah, so we've received over 400,000 tests now in Queensland. We handed out 15,798 kits yesterday to people at our testing sites. We are expecting more, but I want to be clear, the number of tests that the Commonwealth have announced, the majority of those are point of care tests. That is not what we need. What we need is self-tests. We need the rapid antigen tests, because the point of care tests, if we give those at our testing clinics, it requires staff to do the test for the individual, to keep those individuals there waiting 15 to half an hour, and to then track all of their information and their positive result in our system. So it actually adds to the administrative burden of our testing clinics and does nothing to reduce the lines by giving us predominantly point of care tests instead of kits that people can take away. And if I can get the Commonwealth to do anything, it is give us more of those self-assessment kits for people to take home, to take pressure off our testing clinics. Well, look, we know that they're the greatest risk. What we are doing is we've got people being pulled back from leave right now. We have the protocol in place for essential workers, so if they are otherwise well, fully vaccinated, asymptomatic and have not tested positive but they are a close contact, then the HHSs have the authority to ask those people to come to work as well. So we've got mechanisms in place that if we need to do that, we can bring those people online. As far as those people who have chosen not to get vaccinated, who are either taken leave or are going through an exemption process, we have from day one already put in place protocols that if those people can be utilised in the health system somewhere else that doesn't require face-to-face contact with patients, we're doing that as well. Look, we always knew that there'd be some who choose not to. There's, I think, around 2,800, I'm happy to check on this, about 2,800 of those who are just on long leave anyway. So people on maternity leave, long service leave, who don't need to prove that they're vaccinated until they are due to return to work. So not all of that 5,000 are people who otherwise would be at work but for their vaccination status. No, so some have chosen to take special leave, some are on unpaid leave, some are on show cause at the moment, and some are waiting for their exemption applications to be finalised. As far as I am aware, there is no one who is unvaccinated who is working directly with patients and putting patients or staff at risk.
Pathologists are calling for PCR testing to be restricted to high-risk groups like healthcare workers, hospitalised patients, aged care and disability. But would you in Queensland support that?
Look, those are discussions that are being had at a national level. I think there needs to be consistency on that. Certainly I'm not aware of any jurisdiction that says to the general public you are not to come forward for PCR tests anymore. I think, we will get to a point that the majority of the population are just doing rapid antigen tests at home. But we are not there yet. And so, you know, the current instructions are, if you are due for a day 6 test as a close contact and you can't get access to a rapid antigen, you can come forward for a PCR. And also, if you're symptomatic and can't get access to a rapid antigen, you can come forward for a PCR test. And you know, we're not going to tell people that they shouldn't come forward to a PCR test if they are unable to get those rapid antigen tests. They may have had conversations with the Townsville Hospital and Health Service, but I'm not aware of that request. Well, that's up to the individual HHSs and the clinicians, but we have said when we first brought this mandatory vaccination status in, that we would work with those who are unvaccinated, and there may be circumstances that while their application's being considered, people who have just said, I'm not getting vaccinated, that's it, or they've had an exemption refused, they will not be in the workplace. They should be given a show cause, and more than likely their employment will be terminated if it hasn't been already. These are people who either, for whatever reason, may not be getting vaccinated right now, or they're waiting for an exemption application. If there's somewhere that they can be working in the health system, that is not putting patients at risk, but that is up to the HHSs to work out who those people are. But the majority of people, I'm not aware of any numbers of unvaccinated people working. As far as I know, none of them are working on the front line, and nor should they. That is an absolute last resort, to have unvaccinated people working on the front line, because vaccinations are about keeping our staff and the patients and visitors safe. So we are calling back people on leave, and we are bringing forward our critical essential workers who are on close contacts. That's our protocol. So there's no changes to the protocol at this stage about the 90% double dose. However, where we are with the 90%, I know it feels like it's been taking a while. Today is actually the 3-week mark from when we hit 90% first dose. We only just hit it today, and that's 3 weeks. So everyone who's had Pfizer, who is due for their second dose, would only be eligible now. For those who had Moderna, they're due in a week's time. So, you know, you do the sums. We are on our way to getting 90%. We're just over 2% away from hitting 90% double dose. You know, we will hit that before the end of January. So we'll be having discussions this week just about looking at the 90% double dose and whether there's anything else on top of what we've outlined that needs to be revisited based on what we're seeing as far as cases and everything else at the moment. Yes. Yes.
That's a fair statement. I think that's a reasonable statement. We've gone into this pandemic with almost 90% vaccinated and very few cases prior to that. We're facing the Omicron strain, which we know is slightly less virulent, slightly less severe than the Delta strain. We're now up to about 95% of our isolates are now Omicron. The next few weeks is going to be tense in the health services. As we see numbers rise, they will rise, and we're waiting for that plateau. And the plateau of cases in the hospitals will be a week or so after the plateau of cases in the community. So somewhere in that first or second week of February is when the hospitalisations will start to plateau and fall, assuming all the mathematical modelling is correct, which by all accounts it looks like it will be. So I think we are doing reasonably well, but the next 3 weeks will be tough. there will be a lot of people admitted to hospital. There will be significantly more intensive care admissions than what we're seeing now. The AHPPC has no position on the opening of schools. Queensland was in a slightly unique position insofar as our projected peak, corresponded almost exactly with when the planned opening of schools was. And you'll have to look at other states, but I think you'll find that our projected peak in the last week of January corresponds almost exactly with when the planned opening of schools was to occur. And if we can just flatten out that peak a little bit by pushing the school opening date forward by 2 weeks, that will reduce a lot of strain on the hospital, because we're expecting a short, sharp peak, and there'll be that's what we're expecting, and that will be associated with a short but very substantial increase in hospital admissions. So there will be a lot of people in hospital for that time around between end of January, early February. We're expecting that. And most of them, again, want to make this clear, will be in that moderate range, not the intensive care range. There will be quite a few in intensive care. So there'll be people who come in that are just a little bit sick, maybe someone who's a bit older, maybe got underlying medical problems. Maybe we should just watch them for a day or two. Oh, they're okay, we'll send them home. Some will require oxygen for a few days, then we send them home. That's that intermediate level of sickness, not the intensive care level. But I really must emphasise, there will be substantially more intensive care admissions than just 27. This is a very small number.
Sorry, I might just add something to
yes,
that
certainly.
as well. Can I just on that issue of the schools as well, can I say this, that it's not just about hospitalisations, it's also about our health workforce. A lot of our health workforce are parents with young children. We saw from the Indooroopilly cluster that we had hundreds of doctors, specialists, nurses taken offline because they were positive or they were close contacts. And we know, and I've just had the Children's Hospital here say thank you for the decision we've made to delay it, because there's a lot of there's a lot of staff here with young children. If those young children quickly spread the virus over those 2 weeks that we're having our peak, that's more health workers offline. So we've got to look at that as well, and that would have a real impact. Sorry. Well, what would they say to our health workers who have to look after the people in ICU? What do they say to the family members of those who end up in hospital because they've been so reckless and they're happy to get COVID and spread it to others? That's who I think about when I go to sleep every night, the people ending up in hospital and ICU, and the people who may very well lose their lives because of this virus, or because of something that you can control and you choose not to. It's reckless, it's irresponsible.
I've read about these reports of COVID parties. They are utterly ridiculous. There is one way, the best way to get immunity to this virus is through vaccination, not through COVID parties. They are ridiculous. So please stop them. Please stop. I do want to make one point of clarification about maybe something I said before. When I'm talking about hospitalisations associated with the schools opening, I'm not talking about lots of children being admitted to hospital. That's not what I'm talking about. We just know that when schools return to normal functioning, you get a lot more transmission of virus in the community in general. So it's not that we are concerned about large numbers of children being admitted to hospital, just to be clear about that.
Do you have an update on the number of Queensland Health staff who are out of action due to COVID or
Yeah.
close contacts? Do you register contacts working in COVID wards at all?
We have 2,138 healthcare staff who have tested positive for COVID, and we have 2,715 close contacts. There may be some close contacts being monitored and working in the wards. I'm not certain. There definitely are no positive patients, but it's possible that there might be some close contacts who are being monitored and being swabbed daily and working in the wards. That is possible. Yeah. To be honest, I think the principal reason is the number of people that are travelling there from interstate. You've had a lot of incursions, a lot of spot fires from people who just because their tests were negative before they crossed, they've become positive after they've arrived, and that's the main reason. We know that the more of these spot fires that you have from incursions from elsewhere, the more likely the virus is to spread. The lower vaccination, slightly lower vaccination. I mean, it's not terrible on the Gold Coast, but it's slightly lower, the vaccination rate. It's a little bit disappointing. So we'd like to see it up at 95%, given that it is such a big tourist spot. But I think that contributes. And also, we have heard from the police repeatedly that mask wearing is poorer there. But I think the main reason is the interstate travellers. No, I think as much as possible, I think we should continue our lives as normal. That is our plan. That is our way forward. What is happening here is inevitable. We've made this minor change to the start of the school year, but I think as far as possible, most of us should be continuing our lives as normal. There are some notable exceptions, I would suggest. People who aren't vaccinated should certainly not be out in the community. People at the moment who have immunocompromised, those who are elderly, should probably be avoiding large crowds at the moment, particularly if they have not received that booster dose of the virus. But as far as possible, I think most of us should be continuing our lives as normal. I don't think we should be allowing our lives to be disrupted too much at this stage by this virus. This is the staff, or... I think what inevitably happens when you have an outbreak and something new like this, and I've been through this a few times myself, once you actually start to see a few patients, particularly those who haven't treated COVID before, once they've started to see patients with COVID, they realise, well, they're actually no different to other patients that we're used to looking after. And that initial anxiety settles down. And I've experienced that personally myself with COVID. I experienced that with Ebola in West Africa. Once you see these patients and you realise they're just people like other patients you're used to seeing, and I think that anxiety will settle. I think it is the anxiety of the unknown, and once you realise that, well, it's just another virus. It is just another virus. It's not. There's nothing mystical or magical about it. It's just another respiratory virus, and in this case, we've got an effective vaccine, and I think that's it. I think it's as you exactly said, it's the fear of the unknown.
Yeah, I know the Department of State Development is having those discussions. Also transport, I know Department of Transport and Main Roads are working with logistics as well and freight operators. So, the protocols there, they're aware of the changes. We want to make sure that, they've got to work through, but even with these changes, the employers have still got to work through with their individual workers who is well, and who is capable of coming back to have the workforce they need. So it's not surprising that that's going to take a little bit of time for employers to work through and contact their workers who are close contacts and make sure they satisfy those rules before they're allowed to ask for those staff to come back. Those are the changes that, because our restrictions around density and all that's already changed, this is particularly around the quarantine requirements and the requirements to get tested. So people from interstate hotspots at 90% double dose still have to be fully vaccinated, but will not have to do either a rapid antigen test or a PCR test. And international arrivals who are fully vaccinated won't need to quarantine. Not when we're heading into a peak of the virus, no. No. Thank you. Thank Bertie.